60% of cases of stomach cancer in the United States are associated with what infection? A. Staphylococcus aureus. B. Salmonella enterica. C. Escherichia coli. D. Helicobacter pylori. The answer is D. Helicobacter pylori. Helicobacter pylori is present in the stomach of 60% of individuals with gastric cancer. Cancer in these cases may be caused by chronic inflammation at the site of infection, resulting in metaplasia. Staphylococcus aureus, Salmonella enterica, and Escherichia coli are all common causes of gastroenteritis but are not associated with malignancy. Which of the following is not a risk factor for renal cell carcinoma? A. Hypertension. B. Alcohol. C. Smoking. D. Obesity. The answer is B. Alcohol. Smoking, obesity, and high blood pressure are among the most common risk factors for development of renal cell carcinoma. Other risk factors include genetic susceptibility, diuretic use, and male gender. Alcohol consumption has not been associated with increased rates of renal cell cancer. Renal cell carcinoma can cause what perineoplastic syndrome? A. Syndrome of inappropriate antidiuretic hormone secretion, SIADH. B. Polymyositis. C. Hypercalcemia. D. Lambert-Eaton myasthenic syndrome. The answer is C. Hypercalcemia. Renal cell carcinoma can cause hypercalcemia, due to secretion of PTHrP, parathyroid hormone-related protein. SIADH and Lambert-Eaton myasthenic syndrome are both associated with small cell lung cancer, while polymyositis is associated with non-Hodgkin lymphoma. What cell line is metaplastic in multiple myeloma? A. Neutrophils. B. Plasma cells, also known as memory B cells. C. Natural killer cells. D. T cells. The answer is B. Plasma cells, also known as memory B cells. Multiple myeloma is caused by metaplasia of plasma cells. No other white blood cell type is typically metaplastic, though abnormal plasma cell accumulation in bone marrow does interfere with the synthesis of all other blood cell types. Hepatocellular carcinoma is also associated with what toxin? A. Lead. B. Organophosphates. C. Aflatoxin. D. Asbestos. The answer is C. Aflatoxin. Hepatocellular carcinoma is associated with exposure to aflatoxin, from Aspergillus species, which can be found in many foods. Most commonly contaminated foods are corn, peanuts, and peanut butter, pistachios, Brazil nuts, chilies, black pepper, dried fruit, and figs. Asbestos is linked to mesothelioma. Organophosphate exposure is linked to leukemia, and lead exposure has not been directly associated with any increase in malignancy, although current studies are pending further evidence.